Hello and welcome to McLaren Port Huron Today's Health Program. Today I'm speaking with family medicine physician Dr. Reid Stromberg about some health concerns that we see in certain age groups and generations. So, Dr. Stromberg, thanks so much for joining us today.
It's my pleasure. Thanks for having me.
So let's start with the baby boomers. So those are ages 54 to 74. What are the common things that you see in that generation?
So typically, I drop that down to about 50. Typically that's when we start doing routine cancer screenings for people. Specifically, a colonoscopy is recommended at 50 for that age group, along with regular yearly blood pressure measurements, yearly checks of their sugars, and screenings for prostate cancer if warranted. Also, yearly mammograms for women.
So really every year you want to see your patients then over age 50?
Yeah, typically in that age group, yes, if not more frequently. Certainly if they have high blood pressure, diabetes, or other underlying medical conditions, more frequently, but definitely yearly once they hit 50.
Very good. So what kind of things are you seeing in this age group? What are people coming to the office complaining of after age 50?
So it varies a lot, but arthritis pain is a common one that we see. Typically we'd ask them to come in if they have pain that affects their ability to walk, if their symptoms are debilitating or worsening instead of getting better, if they have swelling or redness to any joints, things like that. It might not be just wear and tear arthritis.
And we do know that heart disease is a common concern once we get over age 50 as well. How often do you usually recommend that people come in just for routine blood pressure checks?
Well, if they're hypertensive, probably at least every 6 months, especially if they're taking medication for it. If they're pre-hypertensive, maybe a little bit more, just to follow them to see if they're going to require medication.
Yeah, what are some of the risk factors then for someone for hypertension or heart disease?
So for hypertension, heart disease, the risk factors would include diabetes, smoking, obesity, to name a few. There's certainly more. A family history, can be a factor as well.
So for your patients that do have high blood pressure, what do you tell them to help reduce their risks related to all the issues that can come with hypertension?
Well, if their blood pressure is elevated and it's consistently elevated, medication treatment is our first line after lifestyle modifications. Certainly we know not everybody's capable of losing 20 pounds easily or modifying their diet to reduce their sodium intake to 2 grams or less a day, especially being that we live in America. That's not very practical for most of us.
So by really continuing to take their medications, then that helps reduce the risk?
Yes, it does normalize the risk for heart attack and stroke at that point.
And what would maybe be some signs and symptoms that someone might say, recognize and say, I should make an appointment?
Well, certainly if anybody's having any chest pressure. We always talk about chest pain, but it's truly pressure. Men experiencing chest pressure, especially radius to the left arm, can be a sign of angina. It isn't always. It can be other medical conditions. Women and diabetics typically have varying symptoms that include sweating, dizziness, fatigue, inability to climb stairs without becoming short of breath, swelling in their legs.
And how often would you recommend that someone kind of keep an eye on that? I know we talked about yearly coming in to at least get a blood pressure check. Do you recommend that your patients maybe monitor it on their own at home as well?
Well, certainly. If they're hypertensive or their blood pressure is varying quite a bit, yes. Otherwise, typically the in-office measurement is accurate and a good baseline of where they are with their blood pressure. Granted, it's just a snapshot, but most of the time it's quite accurate just to follow them in the office. Now, how often we see them will depend on how good their blood pressure is controlled. If it's not controlled, we may see them weekly or every other week until it is. If it's dangerously high, they may need to be admitted to the hospital to get it under control. Right.
You had mentioned chest pain as maybe a symptom or pressure, but when would people know when not to call your doctor, but instead to call 911? What do you tell your patients?
Yeah, if you're having chest heaviness, it feels like an elephant sitting on your chest and you can't catch your breath, that would be a good sign that you should proceed to the emergency room.
And in this age group, I've seen even some commercials that talk about hepatitis C. Can you talk about why that's important for this age group?
Well, currently there's no immunization for hepatitis C. In fact, they didn't develop a test for it until 1989. So as far as testing, that also had lagged. The USPSTF, or the United States Preventative Task Force, made recommendations. This is a group of physicians who get together quarterly to review the data and the science behind what tests should be done. They recommended that people 18 to 79 now be tested once for hepatitis C because of the possible risk of exposure from IV drug abuse, blood transfusions, improperly sterilized dental equipment, sexual intercourse, or the big four.
You had mentioned about that a lot of patients come to see you with arthritis type pain as well when we first started. Now, when would you tell a patient that it's really important to come in and see? Because I think a lot of people think, oh, I'm over 50, of course I'm going to have some knee pain, but what do you tell them when it's time to come in and actually have a conversation with their doctor?
Well, certainly if their pain's affecting their ability to walk again, or if they have joint redness or swelling that's not going away with exercise. Typically exercise, and including just walking, can alleviate a lot of those symptoms. A healthy diet can too, but there's other types of exercise other than wear and tear. You know, it might not be that you played football in your 20s and teens, it might be that you have gout.
Yeah, very good. Dr. Stromberg, thank you so much for sharing this information with our audience.
It's my pleasure. Thanks for having me.
And thank you for watching this episode of McLaren Report here on Today's Health. If you would like more information or to schedule an appointment, go to our website at www.mclaren.org/PH Family Doctor. To watch additional videos, visit our website at mclaren.org/PH Videos. This is Kelly DiNardo reporting for McLaren Report here on Today's Health.